Hi friends, Grace Rizza here. I hope you're having a fantastic day. I wanted to touch base with you about Google's recent update with their ad platform. As you know, they introduced a couple years ago, maybe a year and a half ago, their new Performance Max campaigns. And when they rolled these out, they were supposed to be the greatest thing since sliced bread. When they first rolled them out, they did not allow us to refine the campaigns with what's called negative search terms. Then they rolled out the addition allowing us to include negative search terms. And for those who don't know, negative search terms are the words that we put into the campaign, and we are basically telling Google, hey, Google, you're not allowed to use our money for these phrases. So you might put in something like free or cheap, or if you're a dental practice, you might exclude Medicaid keywords because you won't see a strong enough return on investment for those keywords, and it basically won't be a good utilization of your spend. So we're able to refine campaigns through negative keywords, also through analyzing the search radius or targeting area, geography of where we're allowing your ads to run, among other ways that we refresh ad copy, recommend new offers, update images, and add assets like video content. So there's a bunch of ways that we optimize content, especially for a Performance Max campaign. And in recent weeks, Google has allowed us now to see the full list of search terms that have utilized your Performance Max ad spend. So now we can go through each time the campaign has seen a click and therefore utilized spend, and we can see exactly which search phrase utilized your money. So pairing that full exposure like we're used to having with a traditional search campaign with the ability to refine the campaign with negative search terms allows us to refine that campaign, further eliminating risk, waste, and making these campaigns perform better. However, when we refine a campaign, sometimes we see a less of phone calls. Sometimes we see a lower number of conversions. However, those conversions are of higher quality. And therefore, those higher quality conversions should yield a higher return on investment or more actual new patients because the leads that are coming in are for the right keywords for your practice. So, all of this being said, I'm going to summarize what's happening. We're going to see a higher quality of leads but a lower quantity of irrelevant leads. So if you see your stats dip a little bit, it's July 2025. If you see your stats dipping a little bit this month in terms of number of conversions, don't forget your main KPI here is the number of actual new patients and the quality of those leads. Okay, so expect as we're able to further refine these campaigns, less waste, higher quality. All right. So don't panic if you see numbers looking to drop a little bit because you should see the more important numbers, the new patient numbers, and the return on investment going up. All right. So if you have any questions, let us know. I hope you have a great day. And again, this is Grace Rizza from Identity Dental Marketing. If you have any questions for me or my team, visit identitydental.com. Thanks so much and have a great day.